I'd like to welcome our guest today, Dr. Ripoll, who is a urologist and has a long history of medical practice and has graciously offered some time today to talk about both her own practice of medicine and her own personal experience with cancer. So tell me a little bit about your background in medicine. How did you get started and how did you choose urology?
Yeah, absolutely. It's interesting because I actually came from a family of herbalists. But you know how when you're young, you always want to do the opposite to whatever the family's doing, and you think that you're breaking trail and you're different and you're whatever. Youth, when you think you know it all. So I decided that I definitely wanted to treat people. And I was even early on in my life, at age 12 or 13, I thought I had the cure against cancer. So I had always had, ever since I can remember, an inclination of wanting to do that. And my career, and then I came to this country when I was 17. Originally, I was born in Spain and went to high school there. When I got to the US, I did chemistry and biology, and then I started with medicine. Initially, I thought I was going to be a family practitioner, but then as I was doing rotations, I fell in love with surgery. And the reason why I liked urology was because it was a combination of the two. You could be, a little bit of you could be a surgeon, but there was also the humane aspect where you got to see your patients more than once, not just like you take out, a gallbladder and you never see them again. So it was a nice combination of doing things with my hands, which I love, and also being able to talk to people and reach them and converse with them and use that other aspect of myself that I really enjoy, getting to know the actual person and their families, because any disease will affect not just the patient, but the people around them.
Well, I think that's
And
what's
so,
changed in medicine. I think
yeah.
medicine has changed in that sense that the personal individual contact that you make, it's become so different now. And that's what
Absolutely.
people really want. So was your practice dealing with prostate cancer an evolution of as you aged, your patients aged with you, or was it something you chose to focus on?
No, actually, I did urology and then I did urological oncology. So I stayed and did 2 extra years of, after the 6 years of urology, I did 2 more years of oncology. And a lot of my research, even before I started urology, was all about oncogenes and predisposition, genetic predisposition to prostate cancer. So it's always been in my background. Slowly, it's funny how you think you know a lot when you leave residency, and as you go into practice and you face the daily and you face your patients, you go, oh my, I don't think I know as much as I should. And you start realizing that a lot of what you think was really helpful may not be as helpful anymore, and you have to expand. And that's when I ran across acupuncture, became an acupuncturist, and then went back. Acupuncture made sense to me in so many ways because I was in martial arts and I love Chinese concepts. So jumping into acupuncture was kind of a nice natural jump. And things like herbs, I grew up with them. So that was not hard for me to understand that those things would be beneficial. So I was really lucky to have grown in a family where the mind and body connection was kind of integrated inside of me without even realizing it. You know what I'm saying? Trying
Yeah.
to look at the whole picture, not just say, oh, well, I'm looking at a prostate. No, you're actually looking at a human being who's working, has a family, and so much of that can be a contributor to their problem. And if you don't deal with those, the true healing never comes.
Well,
So
and it's
anyway,
important. It's also important that when you're making decisions of treating somebody with cancer, giving them that optimism that there are supportive things that can be done. So you had both sides of that. And I find that people that are dealing with cancer, when an MD says, I do this, they have a lot of confidence that it's no longer in the realm of what
mhm.
people would consider unfamiliar or not acceptable. It really is just another form of treatment. And it sounds like you really embrace that pretty thoroughly.
To be honest with you, the name of my practice used to be Choices in Health. And I strongly believe that every person has to make their own choice, and it has to be theirs. And what I'm here for is to give them honest information, present it to them, say, these are the choices. This is pros and cons for this one, for that one, to try also to get a sense for what's important for that person, and then kind of guide them a little bit, but ultimately having them empowered and having them choose and having them be is extremely important in any type of disease. The minute they take the backseat, poor guys, they can make wrong choices. They can be easily manipulated by, other practitioners. So I think what's important is to allow them to give them enough information, not too much initially. You have to know at what rate to present it, how to present it. Some people love a lot of data, so you do a lot of, statistics. You look at other people and you go, no, they don't want statistics. They just want you to listen. They tell you, I had a poor patient that said, if I'm incontinent, I don't know that I can live. I would kill myself. I go, whoa, a radical prostatectomy is definitely not for you. Let's explore other avenues that would be, that would never lead to incontinence. So I think so critical is to listen, because I think the patient knows so much about themselves and about what's important to them. And even they have an incredible intuition as to what works and doesn't work. So if we listen and then just facilitate the information and then provide a terrain where they can bloom, and
Well, I
become
think
their.
part of that is that a lot of oncology people don't really want to, they're not totally honest. I mean, it sounds like you're pretty honest with saying, look, if you have this done, this is what can happen. I mean, I don't know, if you're not prepared and you don't have a chance to think about it, I mean, we're not the ones that should be telling people what to do. And it sounds like you were pretty honest with, you're at high risk, you're at low risk. So that independently tells people that they need to realize they have to do more. But it sounds like you gave people the ultimate choice of how much and how you wanted to do it.
Absolutely. I mean, you have to put it in perspective for them. That's why they come to you, so you can help them put it in perspective. It's not the same if you have somebody who has a very tiny prostate cancer, which a lot of people do. And so you counsel them and say, we're so fortunate we got this early. You have better options than some other person, poor guys that are already present with metastatic disease. So put it in perspective for them. Give them up. Never false hope, never, but never give them a negative outlook either. I always tell them, I'm just a person, and I don't know everything. And I've seen truly miracles out there of people that have done extremely well, even though everybody else said they wouldn't. I said, you cannot lose hope. And you have to realize that there's a lot that you can do. And I always tell them, cancer is not just anatomical or physical. It's emotional, it's spiritual. And so I really invite them to look at it the whole way. I don't care which spiritual practice they have. It's about helping them connect to whatever it's important to them. I mean, and that's my role. I'm not there to counsel them in any way about which spiritual practice is better or not, or you should do this, or no. It's like, do you have a spiritual practice? Yeah, I used to, but okay, well, let's explore that, Yeah, and then mentally, I always give them examples. I love this example about two cases that I know they're real. One of them was a woman that they made a mistake in the pathology, and they told her she had cancer. And so she started getting really sick, developed metastatic disease. Later, they realized they had confused the samples with somebody else. And they said, we're so sorry, you never did have cancer. All of a sudden, all of the cancer cleared up. So I tell them the mind is supreme, and it can work against us, but it can work in our favor. So let's engage it, in a positive manner. So I always try to bring examples that are true, and I'm not lying, but that gives them another possibility, how if they look at things in a more positive way, you just never know. I mean, I can't promise them that their cancer is going to go away. That's not my job, no? But I can say that a better outlook, definitely makes a big difference,
Well, making a little transition here, you've talked a great deal about how you have a mutual decision process with patients and what you did in terms of treating people with cancer. Tell me a little bit about your own personal experience, because you've got to apply all of these same professional concepts to your own personal life. And tell us a little bit about what happened and how you use these same concepts about your own decision making.
I'm not gonna lie, it was a shock because I never, I'm kind of the kind of person that never thinks anything bad's gonna happen. I kind of go through my life. My husband laughs at me. He says, "You just go through life. You've always done that, and just never consider that bad things can happen." I said, "Well, that's true." So at first it was a bit of a shock, and then as I analyzed it, I thought, "Well, oh yeah,
Tell people a little bit about what was the
sure."
shock.
Yeah, so I started, I had a cervical cancer. I started having symptoms, went to the gynecologist. They did an exam. They said, "Oh, you have cancer and we need to do surgery." And, and it made sense. Having a cancer in your cervix, I was okay with that. Let's take the uterus and the cervix out. Let's do a lymphadenectomy. So that initial treatment for me was totally congruent. I didn't have any hesitation. So I went. The surgery, thank goodness, was perfect. I stayed in the hospital one day. It was amazing. By the next day, I'm like, I'm out of here. I'm going to go home, walk, do all the things to prevent from having complications. Because I knew if I went home, I could do herbs, acupuncture, other modalities that would help me deal with the pain. I don't like narcotics and I don't do well with them, etc. So, but then when the pathology came back, they said it was metastatic. And the gynecologist said to me, and that I thought, thank God that I've done this for a long time. But he said, "You know what? If you don't do radiation and chemotherapy, you will be dead in 2 years." I'm like, whoa, that's, I said, "Do you have a connection with God? How do you know that?" I said, that's a very bold statement to make. I understand that you're trying to maybe tell me that this is a little more serious than we thought, but to give me a deadline, which I think is one of the mistakes we make as physicians, and I've seen it affect patients in a very negative way.
Absolutely.
Where the guys, they go, "Oh, 2 years," and in 2 years they die. And I'm like, I was not about to buy that. So I did a lot of introspection. And for me, it was about realizing, how was I living right now? Well, I wasn't living. I was disconnected with my spiritual practice. I was disconnected with my body. I was working too much. I was out of balance. So it became really clear to me that I had to get back into balance. I had to sleep. I had to eat well. I had to do all the things that I know are right. And then I had a spiritual experience that made a big difference for me. And then I realized that for me, a lot of it was going to be mental, spiritual, and just taking responsibility for the fact that I hadn't taken care of myself at all. And that I had used the quote of, "Oh, I'm helping the world and I'm helping my patients," as an excuse to totally ignore myself. So, in a way, it was becoming honest with myself and say, "Okay, you're not doing these things. Why? And how can we change that?" And that was huge.
May I ask you, did you, for an average person that doesn't have a background in medicine, what can you recommend to them to be able to find out about these limitations that they need to transform and rise above to get help? Because
Sure.
what happens sometimes is you start going to other people and they give you advice that, figuring out for yourself what to do. Do you have a way of recommending for people where they can go to look, or do they just need to basically sit down and look at themselves and then decide what they need to do?
There's no doubt. I'm a big believer in that. I'm just one little feather in a bird when it's or whatever, maybe just a wing or a leg, it doesn't matter. I realize that I'm just one person and I'm just a person. So even when I was treating my patients or myself, I brought other people that were better at things than I was. I love Chinese medicine and I'm okay with it, But there's some Chinese medical doctors out there that are much better than I am. I had some friends that were awesome people that practice homeopathy. I had other friends. So even with my own patients, that's why I say, how do we singularize a treatment for that person? Is helping them, okay, if you want to go this way, let's also make sure go see this person who is really good in nutrition, or, and it kind of help to see what's around you. But realize that I'm not the only one who can help this person. So how do I facilitate, like you're saying, how to meet the right people? And once
Well,
again, I would,
the other
yeah,
aspect is that you can be the kind of chairman of the board. You can kind of be the director, but allow other people to perform what needs to be done. But you have the expertise of the global picture. So
yeah,
I think that, like you were saying, somebody that has prostate cancer, let's say, or limited cancer that can be observed versus somebody that's aggressive, you still need somebody that can bring reality and say, no, you probably shouldn't just be doing
of course,
thing if you have a serious condition. So you
sure,
have to help people know whether it's something to add, it can be done independently.
sure,
It's how do you set up your team? And I think that
yeah,
that's a real important thing you're mentioning, is that the team that you have becomes the real essential. It's not about you as the individual, it's about the patient as the individual.
That's exactly. And I think as physicians, sometimes we forget that. We get so involved in the day to day and hurrying and only having 10, 15 minutes and, all these crazy stuff. We forgot how we always say there is the practice of medicine and then there's the art of medicine. I think we're forgetting that, you see some of the old practitioners, those people were magnificent. I mean, they could look at your skin, touch you, look, and they could diagnose all kinds of things. Now we just have to have like 1,000 different x-rays, and we have to have this and we have to have that. And it's just, I think, remembering some of those old practitioners and trying to mimic them or remember their essence is super important too in our
It's part of that.
practice.
It's part of that connection to the patient. When you touch someone or you speak to them in a compassionate manner, you're part of getting into what they're willing to tell you and work with, rather than just, this is what
Exactly.
you are. You are no longer Jonathan Collins. You are now
Yeah.
that prostate cancer patient.
Yeah, exactly. You meet them where they're at and you bring them along as fast as they can go or not. I mean, I've had patients that I would tell them, look, this is what people tell you to do. This is what I would do for my father or my brother or my husband. And then one guy was really cute. He says, but do you love them? I said, well, absolutely. And I said, oh, okay. So that was really cute. But I would say, look, this is what I would do. And if a surgeon tells you you don't need surgery, trust them because they love surgery. So if they're telling you there's other ways to do this and you're lucky enough that you're early enough that you don't have to. And so I tried to also speak it in a way that was understanding, and reachable and not, sometimes as physicians we forget and we start giving data and statistics and blah blah blah, and the poor person, you and I know, the minute the word cancer comes out of your mouth, you've lost them.
Yep.
If they remember 10 or 20% of what you're telling them, it's a miracle. Even if they're taping it, or if they have I used to tell them, if you want to tape all of this, tape it. If and definitely bring the person that is next to you, the relationship didn't matter, whoever is your partner in life, or in your journey, bring them. But even then, for me, it was meeting many times, no? And some people, it was only once, that's all they needed, and other people needed, but it's kind of like, it's shocking to hear you have cancer. And you're like, okay, boom, closed doors. Slowly, then you have to bring them along.
Well, I think that's a major part of it, is that when you tell somebody that, I think a lot of people get that experience because they might have a biopsy done and somebody calls them up. I think
Yeah,
telling somebody they have cancer, but telling them on the other side of that, that there's hope and optimism is an
yeah,
important thing. But the other aspect you just described that people don't often recognize is people get PTSD from this.
absolutely.
It's one of the most traumatic things you can say to somebody out of the blue and expect them to just be able to, oh yeah, I can just walk through this. I'm okay.
Exactly. Exactly. It's so true. It's so true. And yeah, and I think we forget that. And I'm sad to sometimes to see the system where it's all about documentation. I used to spend more, well, not me, because I didn't believe in that, but even then, I have to document all of these. It takes me 20, 25 minutes to document, but only 5 minutes to talk to the patient. It should be the other way around. It's like, talk to the patient. Documentation, of course, is important, but it's not what it should be. And if you don't pay me as much because I didn't write this thing, it's just tragic the way that things are changing in medicine.
So it doesn't sound like how you treated patients in your practice varied very much from how you looked at your own cancer. You looked at the same parameters,
Mhm.
and you were able to produce a team. You were able to see how aggressive or how indolent it was. And you applied the same principles in work as you did in life, which I think is something that most of us need. That's a balance that's so important to be able to do.
Yeah, I was fortunate. I mean, I am blessed because I did have such a good friends that were so knowledgeable, and to be able to reach out and get their opinion and say, what would you do? What would you say? Because you lose some of the perspective when it's affecting you. So I was blessed, and I used to never on the first or second visit, but even before I had cancer, I used to tell people cancer can be a blessing. I know it doesn't seem that way right now. But I said, I've seen so many of my patients say, I started living. I started enjoying my family. I started doing the things that I hadn't done. So I try to invite them to see the opportunities that could bloom from the cancer, not just oh my goodness, I need this or I need that. So, like I said, I never said that at the beginning because the poor people are not ready to hear that. But I honestly believe that. And so when it happened to me, I felt the same way. I thought, okay, this is a chance to I used to think I have a white canvas now all of a sudden, and I can paint in it whatever the heck I want. And it was very freeing all of a sudden not to have to work as many hours or none at all if I even want to have an opportunity to redo my life, and then the flavor, flavoring not just food, but my family or moments or sunsets or whatever. You start truly being present. And I think that's really important.
I'd like
A
to
lot
go
of
back.
us forget that.
I wanted to go back to one aspect. You said that, the doctor told you that you would be dead in 2 years, and not on a specific basis, but what things did you feel you had to be doing? You've talked a little bit about an attitude that you could adopt, and also about your spiritual connection. But on physical levels or on lifestyle levels, did you have some general concepts that you tried to integrate into your life because obviously as a physician that you're saying, I'm going to do something different, you have to do it has to be a global process. And you said you did acupuncture and homeopathy and herbs. Were there other things that you looked at? And
Absolutely. I mean, I think for me, more than that, I knew I had to change the way I thought, and I had to reconnect with what's important. And for me, ever since I was a child, I never felt I was alone. I felt like I was, even when I came to the US and I was alone, I never felt, I've always felt there was something. I never knew what to call it when I was a child, but that kind of prepared. I mean, like things, whenever I needed things would pop up. And I always had the confidence that whatever I needed was going to pop up. So in that respect, I've always been lucky that I've been able to trust that whatever I need will show up. And I'll be two things that are important about that. No doubt that that's easy to do when everything is going well for you. So, but when things are starting to be in your face, like saying you're going to die in 2 years, some of that, of course, is like, well, okay. But the other thing is, I was fortunate that I've never feared death. I don't know why. I was never fearful of dying. I was fearful of, more than dying was the same thing patients tell me, pain. I said, okay, if I have to transition and if this is my time, okay. but the fear of having pain, uncontrolled pain, or some of the other aspects, no? And then what I started doing is reading some of those. There's some really good books about stories of people, depending how the cancer never came back and this and that. And I thought, if my mind can work against me, I'm going to have the body. So I started playing music that was all about power songs. I can do it. I know it sounds childish, but I had music. I started dancing because I love dancing. And then I decided that I remember one thing that one of my professors said: you don't have to be sick to die. And then I thought, well, hello, I can die from other things. So why be worried? Just start focusing on living and all the things that make you want to live. And if that doesn't work, then you've tried everything you can. So, but that was the point. It was, I think, more than anything, is starting to live. And I had not lived for a long time. I was existing, but I was not living. And that's a huge difference.
One thing I would ask, when you mentioned this concept of pain, you saw enough patients that were moving towards the end of their life. Did you use palliative care and hospice, and did you find that it was useful?
I mean, I don't know why. I did have a lot of people, because I used to do also alternative medicine in my office, like IVs and other things like that. So I had a lot of people that would come to our clinic, to be treated, even if they didn't have prostate cancer. And particularly my favorite patients were always the ones that were more towards the end of, and I also realized that death, it's not always that. I mean, a cure is not always drugs, medication, acupuncture. Sometimes, that person transitions and it's where they need to be at that moment, but how to help them do that, no, that's one thing. And the other thing is, I had this patient, is really cute. She told me one day, you know what, if I would have known I would have lived this long, I wouldn't have sold my house and given everything up. She says, she was already in hospice when she came to see us, and then she got out of hospice and everything. I said, well, I am sorry. She goes, no, I actually like the alternative. But and that wasn't me. That was just her starting to, for whatever reason, that was her journey. But anyway, I think that what's most important with patients, and even with myself, is respecting our own journey. Each one of us has something that is very personal, something that we go through. And yeah, there will be a point that I may get old enough, of course I'm going to die or whatever, but not be fearful of death, honestly, or disease. It's just focusing on what you want to happen. No, and I used to tell my patients, look, the universe does not know the word no. You keep saying, oh, I don't want cancer. I don't want this. I don't want cancer. But all it hears is cancer. You're focusing all your energy on cancer. And I used to try to help them focus on the energy of living. What makes you happy? What makes you live? And that, I think, is super important, not just drugs or medications or surgeries.
It's very interesting that way also. I mean, here thinking about talking to a physician that treats cancer and has had cancer, we didn't talk about statistics, we didn't talk about drugs, we talked about how to be a person and how to move through the journey in a way that works for you as an individual. And I think that says a lot for both what you practice and what you recommend to people. It's not, you have to do a specific diet, you have to do these specific supplements. They're very important, but it's the attitude of, I want to continue my life in the best way I can and make the choice what's best for me and not have somebody else do it.
Exactly. I think that you said it so beautifully. You summarized it beautifully. Thank you. That's exactly. No, I'll be honest with you. That doesn't mean I didn't talk to them about statistics or, because each person is unique. There's people out there that they don't want any of they call it fluffy stuff. Just give me numbers. Well, okay, I'll give you numbers. You still can give numbers in a kind way and in a positive way. You know what I'm saying? It's how you use that tool, not the tool itself, that is important. So anyway, I think that that's super important to to know how to use the tool for each person. But and no, did I get it right all the time? Absolutely not. I messed up a lot, but because I had a team around me that were really good, whatever I would miss, somebody else would pick up, thank goodness. And they would then expand, and I'm like, oh, thank God, I didn't think of that. So that's the beauty of working as a team, you know,
Well, that's
having that.
also the importance of recognizing that you're not the one that has to make all the decisions. You know, as in what you did, if you felt like you made all the decisions, that's an awful lot of stress and a lot of burnout potential for a doctor to think that they're the ones that have to make these decisions for their patients. When in reality, if it's a partnership, then you're working together to make a decision and you don't have to be responsible for the whole situation.
Yeah, that's exactly. You know, how do we know? We don't know what's best for somebody else, really, honestly. I really don't.
Thank you very much for your time. And we will see what happens with that. I think it's fascinating. I think it's great that you had such an integration of what your life was like in terms of, you know, having experiences with people that were in healing beforehand and
Yes.
carrying that through and ending up back in the same place.
Yeah, yeah. I think it was like so now I think that was a warm up or something. I don't know. It's kind of funny. Yeah.